Hi everyone, thanks for joining us today. This is our session for PCRC 2021, Evolution, Revolution, or Degradation, the Future of Single Case Research. Today we're going to be talking about a variety of issues around single case research and methodology. On the panel today is Ty Collins from University of Cincinnati. He'll be discussing response-guided design. Corey Peltier from University of Oklahoma. He'll be discussing graph construction and the implications of that on our single case design and visual analysis. Kimber Vannest from University of Vermont will be discussing single case effect sizes, and myself and Karen Harris, who's from Arizona State University, will be discussing data requirements and some ethical issues around single case design. So our goals for today are to describe the current issues in single case design methodology, to consider the individual and aggregate costs and benefits of each issue presented, and then 3, to make better informed decisions when it comes to your own work. And don't forget to please join us for the live session that accompanies this recording at 10:25 on February 11th. So this will be breakout A, so we look forward to seeing you there. To get us started, just a little bit of background on where this session comes from. So there are a lot of tensions when it comes to single case design, whether we're thinking about the tension between standardization and individualization, right? How do we maintain really high standards for single case design, making sure our designs are rigorous and allow for really good quality research, versus how do we tailor these designs to meet the unique needs of students with disabilities, which is just a hallmark of special education in general. Right, we have tensions between randomization and response-guided designs, right, the baseline requirements that I'll be talking about a little bit later, as well as the need to treat students, use of quantitative analysis, and a variety of issues just around the way that we talk about single case design. So at this point, I'm going to turn it over to Dr. Collins, who's going to start us off thinking about response-guided design.
Hello everyone, I am Ty Collins and I'm very excited to get our conversation started today. My portion of the presentation will start on the practical side of things when we talk about single case design, and specifically I'll be focusing on randomization and really considering different things that we need to be thinking about when we're using randomization in single case designs. So to tell you a bit about myself, I am an associate professor and coordinator of the school psychology program at the University of Cincinnati, and my research agenda focuses on interventions for Black students in urban schools. So I am really involved in applied research in urban schools that are under-resourced and underfunded to better support Black students in a variety of areas. Much of my work has focused on peer-mediated interventions such as group contingencies, peer-mediated check-in, check-out, and peer management interventions within these settings. And my focus is on these types of interventions for a variety of reasons, including first, the cultural relevance of these interventions, especially thinking about these types of interventions from a critical race theory perspective. We know that Black students attend schools with teachers very often who don't look like them. However, they do attend schools with other students who look like them. So thinking about improving the cultural relevance of our interventions by having similarly acculturated peers implement those interventions and support each other in building those communities of scholars from a critical race theory perspective. Also, thinking about peer-mediated interventions as very feasible in school settings. So adults can work with pairs of peers or triads of peers who are working together, and they can supervise multiple pairs and multiple dyads of peers rather than working one-on-one with students. So thinking about the efficiency of implementing interventions involving peers. And then finally, the feasibility of these types of interventions. These interventions are typically light touch interventions that don't require a lot of effort on the part of the adults in the building who will already have a billion things to work on and a billion new initiatives every year. And so really utilizing peers is a great way to implement interventions in ways that are both culturally relevant and able to be done in these types of settings, especially again considering that they are settings that are under-resourced with lots of needs and lots of supports that need to be available in schools. So this is kind of the approach that I'm taking when I'm thinking about single case design. design and thinking about a variety of different settings in which we want to use single case design, and whether the recent innovations in our field are really appropriate for a variety of those settings. So thinking about randomization, Cradwell and Levin in 2010 really laid out the case for using randomization in single case design. So one of the first things that they talked about was that educational research, when you compare it to other fields, is very often seen as less rigorous or less valuable. And then within educational research, single case design is certainly very often seen as less rigorous than randomized control trials, right? And so the idea was to take an aspect of RCTs, this randomization piece, and utilize it within single case designs to better improve both the internal validity of single case design studies as well as the statistical conclusion validity. So from an internal validity perspective, you could take an A/B design and use randomization with random phases and now have a more internally valid design. And for statistical conclusion validity, there are different statistical tests that you can run to look at the randomization in your design and determine whether it was effective. And so within the world of randomization, there are different options. You can randomize the phases, as I just talked about. You could randomize the start points, for example, in a multiple baseline design. You could randomize which participant starts in which order, as well as the date or the start point for intervention for each of those participants. You can also use both simple and block randomization. So with simple randomization, if you were using phases, you could just randomly do A and B phases randomly, or with a block randomization, you could randomize within pairs. So you always have A-B pairs, but sometimes they will be A-B and sometimes they will be B-A. So this was really the case for randomization in single case design, taking something from large-scale group design studies and using it within single case design in ways that make sense. So this makes a lot of sense. So what's the problem here? Why are we concerned here about this use of randomization? The thing that I want to bring up is really going back to my original point around the setting, right? So if we're working in settings that are under-resourced, that have a lot of things going on, you can't always walk into that setting with a predetermined schedule that has been randomized and just hand this to a teacher and say, hey, you need to start intervention on Thursday, right? It doesn't always work that way. In many settings, and in many urban settings and many under-resourced settings, it would be great to walk in with that schedule and really have more of a researcher-guided way of going through things. But a lot of the times we're working in settings where we need to be a lot more participatory, right? We need to be consulting with teachers and working with them, working through implementation issues and barriers and things like that. So really thinking about working with the teacher to say, are there 3 days next week when you might be able to start, and then maybe randomizing it within those 3 days. So kind of combining a more researcher-guided kind of ivory tower, come in and tell people what to do method with more of that participatory method that would involve the teachers and whoever's implementing in the intervention. Also, with randomization, you really, again, it's predetermined and randomized, so you don't have that flexibility to be more response guided like we typically like to be within single case design, and you don't have that flexibility to prioritize particular students or particular classrooms. You may see as you're collecting your data in your multiple baseline design that one student really needs intervention more quickly, or one classroom, the data are looking really weird, or there are different things happening, and with the typical response guided approach, you can make those decisions, whereas with randomization, you are kind of locked into the randomized schedule that you have created. So again, thinking about these settings with limited resources, can we just walk in with our randomized schedule and give it to people and expect that to happen in that way? And what are kind of the consequences of that? The larger concern here is if randomization and other types of these innovations become the norm or become expected in single case research, will we see less research from these settings with limited resources, right? So are we going to see our research just kind of return to these middle class settings where things are more easy to be implemented and you can do these really cool, interesting methodological changes? Or are we going to really look at randomization as a great option and as a possibility in different settings, but not a requirement? So that's my concern moving forward, is that we look at randomization as a cool option, but not require it across a variety of different single case designs, or not have people have to justify why they did not use randomization if it was not appropriate in that setting. So I'm excited to talk more about this during our live session. I can be reached at ty.collins@uc.edu. Excited to hear more and hear your thoughts about this idea, as well as hear our next presenters. Thank you.
Hi, my name is Corey Peltier, and I'm an assistant professor at the University of Oklahoma. Today, I'm going to talk to you about graph construction, specifically in regard to single case research designs. So first, we'll kind of situate visual analysis within single case research designs and the role graph construction may play. We'll then look at a schema for thinking about how to categorize elements that are present in graphs. And then I'll present some data from 3 systematic reviews that colleagues and I have worked on. And last, we'll talk about future directions. So big picture thinking, single case research designs have been prominent to inform research practice and policy within special ed, school psychology, and even in medicine when we think of N-of-1 trials. And what we see is visual analysis is still the predominant method used by researchers to make decisions about functional relations and the magnitude of treatment effects. But with that, we've seen some concern with inter-rater reliability across visual analysts, the type 1 error rate as part of a visual analysis process. And we see a host of different variables that we might consider intervening on to thwart those threats. We can think about the type of training that visual analysts receive, perhaps embedding more structured approaches to visual analysis, such as the conservative dual criterion method. There's a whole bunch of research being done in that area. We can think about specific characteristics of the data stream that we've collected and how that might impact visual analysis, such as high levels of variability. If we have trend involved, all of those might impact. But for today, we're going to focus specifically on graph construction and how perhaps thinking about ways to standardize that process, we can minimize some of the impact of inter-rater reliability and type 1 and type 2 error rates. So when we think about graph features, Dart and Radley have a really great paper that I'll include on the reference slide. And they basically lay out a schema in which we can think about graphical elements. And they've categorized them as analysis altering or aesthetic altering. Analysis altering elements are those that, when manipulated, would impact a visual analyst's decision about a functional relation being present and then the magnitude of the treatment effect. And basically, they've conducted 2 research studies, one on ordinate scaling and one on a metric known as the data points per X to Y axis ratio. It's a mouthful. And I've provided both references of those articles too. So basically what they found is if you truncate the ordinate axis, that's going to increase type 1 error rate. So people are going to be more likely to say a functional relation is present and say the magnitude of the treatment effect is larger. The DBPXYR takes into account the X to Y axis ratio along with the number of data points. And they've basically found that if a graph has a DPPXYR value between 0.14 and 0.16, that seems to be the Goldilocks, if we want to go with that metaphor, position. So if it's less than 0.14, the type 1 error rate increases. We then have aesthetic altering elements, and those things might include line thickness, shape of the data points, the placement of the tick marks, and all of those might impact the way we view the graph. But as of right now, there's no data to suggest that that's going to actually impact our decision about a functional relation. I've included these 4 graphs here just to kind of provide a visual for what this might look like. So the very top graph has a y-axis labeled 0 to 100%, so there's no truncation involved. and the DPP-XYRs within the parameters. What you'll see is in the graph right below that, I truncated the y-axis. So you can see now it's scaled 0 to 70%. And by doing that, you can see that the intervention data, that trend appears steeper now. The level change between baseline and intervention now appears greater. So just by truncating the y-axis, it's kind of distorting our visual analysis process. If we look at the bottom left graph, the y-axis or the ordinate is now scaled 0 to 100%. So there is no truncation. However, now what I did is I made the DPP-XYR less than 0.14. And it has a similar, it has a similar distortion to the data. So the trend appears steeper, the level change appears steeper because the data is now squished. And then in the bottom right graph, I actually manipulated the ordinate. So I truncated that and I made the DPP-XYR less than 0.14. I call this the double whammy. It has a major impact on how we view that data stream. And so basically my colleagues and I, we did not invent anything new. We actually just extended some prior research on graph construction. So Kubina and colleagues have done a bunch of work on graph construction, and this paper basically reviewed a whole bunch of graphs presented in behavior analytic journals. And their major findings were that graphs varied dramatically, and very few graphs were being constructed to align with current recommendations for X to Y ratio scale. So the Cooper text that a lot of ABA programs would use, they have recommendations for the length of the X to the length of the Y. And Kubina and colleagues basically found very few graphs fit within those parameters. Ledford and colleagues extended that. So they also coded for the XY ratio by graphs, but then they also considered the number of data points that would be present within 1 centimeter on the x-axis. And that was a nice addition. And it's funny, the DPP-XYR, that encompasses that in their formula for computing it. And so Ledford and colleagues, they included slightly different journals than Kubina. They included some more special education specific journals, but their findings were very similar. Very few graphs fit within those parameters. A really nice addition to in the Ledford study is they then surveyed editorial board members in special education journals and basically found that their preference for graph construction did not align with current recommendations. So clearly people have issues with the recommendations of X to Y ratio. And there's a bunch of plausible reasons. There's no empirical data to suggest we should consider just the XY ratio. It ignores the number of data points plotted along the x-axis, which is what Ledford and colleagues highlighted. So this kind of led our team to do 3 different reviews of graphs across SPED journals. So the first one focused on journals focused on emotional behavior disorders. So we looked at BD and JEBD from 2010 to 2019. I'm going to make this pretty brief. We started with 370 studies. We ended up with 40 studies, including 258 graphs. We then looked at 4 journals in learning disabilities. So we looked at JLD, LDQ, LDCJ, and LDRP. Same time frame, 2010 to 2019. We started with 1,003 articles, and then we found 47 single case studies, including 315 graphs. And then lastly, we reviewed 4 journals focused on autism. So we had autism, focused on autism and other developmental disabilities, Journal of Autism and Developmental Disorders, and Research in Autism Spectrum Disorders. You can see there's a lot more graphs in this batch. There was 5,913. After going through the process, we identified 348 single case studies, including 2,675 graphs. When you sum all those together, it was 435 studies with 3,248 graphs. So first, we did also look at the XY ratio just to see if we found similar findings. and ours did align with Kubina and Ledford's findings. So basically, from the BD sample, only 33 graphs or 13% were within the recommended XY ratio. For LD, 10 graphs, which was 3%, were within the ratio. And then from the autism journals, 102 or 4% were within the ratio. Something I do want to highlight here is there was large dispersion of XY ratios, both within and across design types. So when we looked at alternating treatments design graphs and multiple baseline design graphs, those ratios were very different. But then even within design types, so just multiple baseline design graphs, there was still a lot of dispersion in XY ratio. So there just does not seem to be a cohesive approach to graphing data. Similar findings for DPP-XYR, so 42 or 16% were within 0.14 and 0.16. Same thing with LD, 19, which was 6% of graphs. And then for autism, 238 or 9% were within those graphs, within those parameters. And very similar finding, large dispersion within and across designs. A point I want to highlight is in the multiple baseline design literature, a lot of the graphs were below 0.14. And basically from the Radley et al. Study, they found that if graphs were less than 0.14, that's when type 1 error rates would increase. So basically in the multiple baseline design graphs, we see there may be issues with graph construction impacting an increase in type 1 error rates of visual analysis. For ordinate scaling, results were a lot more favorable. So very few studies were truncating the ordinate, which would reduce the likelihood of having type 1 errors impacting the visual analysis process. So what do we need to do moving forward? So first, we need replication. There's only one study currently on ordinate scaling published in the literature, and that specific study looked at ABAB designs. So ideally, we would want to replicate this with other design types, as well as considering other data collection procedures. So Dart and Radley looked specifically at percent data, so there was a clear upper bound max of 100%. However, there's not as clear-cut guidelines when you're collecting data without a natural upper bound max. So for example, if I was looking at rate data like correct digits per minute on a math curriculum-based measure, how do I set the max on the y-axis? Do I just set it slightly above the max observed value? Do I set it at the max observed value? What am I supposed to do there, and how might that impact type 1 or type 2 error rates? We don't really have any empirical data to provide recommendations. For the DPP-XYR, that has only been investigated with multiple baseline designs. So we have there needs to be some research replicating this with different types of designs to see if the 0.14 to 0.16 recommendation holds. And then lastly, something that I'm personally interested in is how do data patterns, such as if we have trend involved, the magnitude of the level change between baseline and intervention, the amount of variability, how do all those elements moderate the effect of DPP-XYR manipulation or the ordinate scale manipulation? Here's some of the references that I referenced earlier on this slide, so you can check those out before our face-to-face meeting. And a question I kind of want you to sit with before a meeting is it going to be possible to identify empirically grounded recommendations for the standardization of single case research design graphs? Or perhaps are there so many contextual factors related to the design that it's going to be almost impossible to provide clear-cut guidance on graph construction?
Hi, this is Kimber Vannest, Professor and Department Chair in the Department of Education at the University of Vermont. Thanks for joining me today for PCRC Virtual Conference 2021. I'm going to speak for about 10 minutes on effect sizes in single case research, and I look forward to you joining us for a panel discussion later this month. This presentation is about agreement between effect sizes, how we might engage with benchmarking, and what we need to do to improve the quality of our research overall. The opinions I'll share with you today are mine. Effect sizes quantify observed or reported changes in a variable of interest. There are currently more than 50 effect sizes in the literature, which gives us a lot of choices. although we tend to see the same few appear in most publications. An effect size quantifies change, but it cannot and does not inform us about the appropriateness of the design, the quality of the data, the integrity of the research, or the social significance of the effect. For that, we need a clinician or a researcher who can help interpret and provide context for the types of research outcomes we see in the published literature. Effect sizes are only really comparable under certain conditions. Different types of effect sizes will produce similar outcomes only when data demonstrates certain characteristics. If we select and use means-based effect sizes and compare those to effect sizes that may have been or use trend and adjusted baseline, we're very likely to get different effects. We're going to talk more about that in the next 10 minutes. Because these effect sizes are not always comparable, it's important to know which ES metric you're using, which one you're reading, and which one best fits the data for your own analyses. Decision-making and justification is an important part of what we do, and it's something that's currently a little thin or missing altogether from the professional literature. Why are we talking about effect sizes? Well, effect sizes are expected in both the abstract and the results section, according to APA and others. Some consider effect sizes the critical outcome of research, and when paired with p-values and confidence intervals, provide a tremendous amount of information for us to understand and interpret effects of research. Also, they're required by the APA. Selecting an effect size should consider the characteristics of the data. Is there stability in the data? Are there sufficient replications across participants? In these conditions, a between-case standardized mean difference might be a really viable option. But what about if the baseline data are trended, or if the data reflect a very small sample size, or if the designs include things like alternate treatments, or multiple baseline designs across behaviors or settings? These may or may not fit with all of the effect sizes that are currently available. And what I find problematic in the literature is that manuscripts rarely articulate the decision-making of an effect size metric based on data or identify if the decision was made a priori. And this includes work that I've done. Most of us choose the effect sizes after we get the data, and we don't talk very much about how we came to those conclusions and if it's reflective of the type of data that we have in our manuscript. We also don't talk very much about the strengths and limitations of the effect sizes. We sometimes only see that when editors or reviewers are requesting that information in a manuscript. I think we could all do a better job with this. Agreement between effect sizes and visual analysis. We know that visual methods incur a tremendous number of challenges to interpretation. Some specific contributing factors include things like extra graphic contextual variables, or the graphic scale and size. Those can both be very problematic, or the nature of the data itself, such as autocore and indices of effects that are used. All those things can contribute to our visual analysis not being reliable between one and another. So if we have problems with visual analysts agreeing, why would we think a visual analysis and a statistical analysis would match up? And if we're using that, which one is the gold standard? Are we comparing the effect size to the visual analyst, or are we comparing the visual analyst decision to the effect size calculation? I think overall we see a tremendous amount of need for better justification in research reports. Take these 4 examples, P&D, PAND, PEM, and NAP. You'll see that in this illustration, each type of method uses different data and gives the calculation a different weighted impact. We don't talk very much about this in our manuscripts, and I think it can lead readers to misunderstand our results. Which effect size index to choose and why is rarely discussed in the manuscripts in the work that we've been doing to review how authors describe their methodology. Consider, for example, the difference between a means-based effect size and a trends-based overlap or a baseline-adjusted effect size. There are a tremendous number of choices out there. Randomization, Bayesian strategies, multi-level analyses, hierarchical linear modeling, D-statistics, regression, ordinary least squares, GLM, between case standardized mean differences, extended acceleration lines, percentage of non-overlapping data, percentage exceeding the mean, non-overlap of all pairs, improvement rate difference, tau, tau-u, or corrected taus, and these are just a few of the 50 that are out there. Similarly, interpretations of effect sizes are another issue where research reports may be pretty thin. Interpretation is often in relationship to categorical bands or benchmarks, and these things are usually described in initial papers that describe the effect size calculations, how they're employed, and providing guidelines for others to use. I find this to be really problematic and often leads us to an apple versus oranges comparison. The most common interpretation of effect size in current literature is a reference to one of these standardized benchmarks. I think we need to do a better job making sure that we're comparing apples to apples. One benchmark may not reflect the variable of interest or the nature of the intervention. Should we be using benchmarks of general psychology, hundreds of articles to create these, to interventions for depression, for example, or reading? The effect sizes we get for either one of those dependent variables are likely to be pretty different, and comparing them to a general psychological band of small, medium, or large effect size is pretty limiting. It's also pretty widely recommended against. Although we see referencing standard interpretive guidelines as widely accepted practice in the field, there are many who recommend against their use due to concerns with context, generalization, and the arbitrary nature of the guidelines. I would suggest to you all out there who will participate with us in the panel that new meta-analyses could and should report their benchmark metrics. You're starting to see these in single case metas, but it provides a tremendous amount of information for others who follow to use context-specific benchmarks in referencing their work. I'm very much looking forward to the panel discussion, 10:25 a.m. on February 11th in Breakout Room A. I hope to see you there and engage with you. Thanks for listening.
Thanks so much to all of our panelists here. Before I transition to our discussion questions, I want to take a moment here and just step back and try to contextualize some of this stuff that we've been talking about here. So it's really important that as we're thinking about our own designs and the way that we're training doctoral students to use single case research to attack specific research questions, there's a cost and a benefit to all of the different tensions that I brought up at the beginning of this session. Right? And one of those is this idea of these methodological standards that we see in the What Works Clearinghouse handbooks. So in the most recent edition of the What Works Clearinghouse standards, there's a condition for single case designs to actually have a minimum of 3 baseline data points for each participant in order to meet the standards of What Works Clearinghouse without reservations. Now, there's no one involved with single case research who would argue with the fact that we need to actually collect adequate baseline data in order to make any inference whatsoever about the treatment effects of the phenomenon that we're researching or the intervention that we're researching. So having these standards for baseline requirements may be really helpful. However, there are some unintended consequences. So when we have a minimum of 3 data points that are required, that it naturally extends the baseline phase for all participants after the first one, right? Because if you need 3 for the first one in a multiple baseline design, then you're going to have at an absolute bare minimum, you're going to have 4 data points for participant 2 and 5 for participant 3, and on and on and on. And often you're going to need much more than that, particularly if you have data that is unstable or trending in the direction that causes problems for your intervention. So it's really important to make sure that we keep in mind the kind of downstream effects of requiring 3 data points for our first participant. It also tends to mean that we have to ignore our a priori evidence. So oftentimes it's not really necessary to make sure that we have a minimum of 3 data points in baseline, because we have other data that actually show that these students are exhibiting the target behavior at a certain level, right? That's usually why those participants are included in our studies, is because they have a set of behaviors that are problematic, or they are performing an academic skill at a level that it is inadequate. So we have prior evidence before the study that could be really useful in helping to make sure that our baseline data is adequate for determining any type of experimental control. Also, requirements for baseline data, right? Like these can be subject to ceiling and floor effects for different types of behavior, right? You may not get any more useful information if the student already can't perform the skill at all, right? If every data point is 0, collecting additional data points may be of no use. And lastly, there are some serious issues when it comes to treatment and ethics around collection of baseline data. If you're treating something like self-injurious behavior, it really is unethical for you to allow that behavior to continue without intervening in some kind of way. If you have situations where students are practicing something that a skill that's actually incorrect, and it makes it more difficult then to correct that later on, it presents some real challenges for us as researchers, right? Most of us are in this field because we want to do right by students, right? We want to do good work that is helpful to students. So I know many of us are really mindful, not just approaching these projects as pure scientists, but thinking about like what is best for this student at a given time. So we need to be mindful of these potential costs for setting these standards. Again, I'm not advocating for inadequate data or less data in any way when it comes to baseline phase, but just that we do these things in context. Now, Karen Harris, myself, and James Kaufman put together a paper that is available on the CEC Division for Research website that goes into a little bit more depth about many of these issues that we just discussed. Right, you can find that here at cecdr.org/home. Right? It should be available for everybody. So I really encourage you to check that out. The larger point that I think that we're getting at in analyzing the What Works Clearinghouse standards isn't that we shouldn't have standards. It's that standards should be intelligently applied, and these standards are guideposts. Right? They're not meant to be these hard and fast rules that apply universally. They're not meant to be applied outside of context. Right? So as a site that aggregates information across all different types of publications and studies, and having some standards to evaluate the quality of that work is really important. But that's essentially what it's for, right? It's not necessarily meant to apply to journals, and articles are now being rejected because they're not meeting some strict criteria. So it's really important to keep these standards in mind as guideposts that we should be really intelligently applied, okay, given the costs and benefits, not only to the science, but to the participants involved. Now, with that in mind, our discussion questions. So, what role should visual analysis play in determining intervention effectiveness for single case design studies? What are the practical and scientific limits of visual analysis? How can researchers best adapt features of quality group design research to single case design without compromising the core benefits of single case design, especially with students in special education? And what's the role of standardization of practices, benchmarks, and analysis within single case design research? So think about these questions. Take a look at some of the resources that are posted in the comments below. And then please join us for our breakout session, February 11th at 10:25, and we'll be breakout A. So thank you very much. Thanks once again to all of the co-presenters. Really look forward to speaking with you.